Hi, welcome to Dental Knots and Mnemonics. In the last video, we learned that the majority of the periapical radiolucent lesions are a consequence of dental pulpal necrosis, and these lesions are designated as endodontic periapical lesions. There is other group of the periapical lesions which are non-endodontic periapical lesions, and these conditions are a group of conditions which occur in the periapical region and without being associated with the pulpal status of the nearby teeth. These lesions are often asymptomatic and they are often discovered incidentally on the radiographs. These may include the odontogenic cyst, tumors, fibro-osseous lesions, non-odontogenic intraosseous benign cyst tumors, and intraosseous malignancies. It also includes bacterial or fungal infections as well. So without any delay, let's get started with the video. First of all, we should be aware of how does a normal dental follicle appears to be in a radiograph. So the dental follicle is a soft tissue structure which is surrounding a developing tooth or plays an important role in tooth eruption. On the radiographs, it exhibits specific features that help in identifying them. The normal dental follicle surrounding the crown of an unerupted tooth typically appears as thin, uniform, radiolucent space. Normal follicular space is around 2 to 3 mm in width. If it exceeds 5 mm, it may indicate a cystic or other pathological process, like a dentigerous cyst. If we talk about the shape and the margins of the dental follicle is well defined, symmetrical, and regularly, which is present as a radiolucent halo around the crown. The margins are smooth and continuous without any interruption or irregularities. The radiolucent area is usually symmetrical and evenly distributed around the crown. A normal dental follicle does not have a thick, corticated or opaque border around it. Pathological cysts, however, may develop a corticated outline as they grow. A normal dental follicle is asymptomatic and patients typically do not report any pain or swelling in that area. Odontogenic cyst as a periapical lesions include several types of cysts that originate from the tooth-related tissues and are typically found around the apex of the tooth. The overview of some of the common types is first of all the periapical cyst. We have already started it in the last video. This is the most common type of odontogenic cyst. The second cyst we'll talk about will be odontogenic keratocyst, which is now referred to as keratocystic odontogenic tumor due to its aggressive and recurrent nature. It arises from the dental lamina, which is remnants of embryonic tissue that forms the teeth. Most commonly, it is found in the posterior mandible but can extend to involve the periapical area as well. It appears to be well-defined radiolucent lesion in the radiograph with a smooth or scalloped border. It can be unilocular or multilocular in nature. Lateral periodontal cyst arises along the lateral root surface of a vital tooth, often found in the premolar or canine region. It is generally asymptomatic and diagnosed on radiographs only. However, they can sometimes be misdiagnosed as lateral radicular cysts due to their similar radiographic features. Both types of cysts can appear as radiolucencies along the lateral root surface. The key difference is that the lateral radicular cyst has an inflammatory origin, often resulting from the periodontal disease or a spread of infection from the necrotic pulp through accessory canal. Dentigerous cyst, which is also known as a follicular cyst, is formed around the crown of an unerupted teeth, typically associated with the impacted third molars of the canines. Though this cyst is not typically periapical, but it may affect periapical tissues of adjacent teeth. Radiographic features of dentigerous cyst is that it appears well-defined unilocular radiolucency around the crown of an unerupted tooth. Radiolucency attaches at the cemento-enamel junction of the tooth. Dentigerous cyst also causes the expansion of the bone in mediolateral direction, thus causing facial asymmetry in the patient. Non-odontogenic cysts as a periapical lesions are rare but can occasionally be found near the root tips of the teeth. Unlike odontogenic cysts, these cysts do not originate from the tooth forming tissues. Instead, they arise from other developmental remnants or the defects. Here are some examples of non-odontogenic cysts that might appear in the periapical region. The first of all is nasopalatine cyst, which is also known as the incisive canal cyst. The most common non-odontogenic cyst, it forms in the nasopalatine canal between the maxillary central incisor. It appears as a round or heart-shaped radiolucency, and it can be mistaken for a periapical lesion as well. The second cyst is globulomaxillary cyst, historically described as a cyst in the globulomaxillary region, which is nothing but a region between the maxillary lateral incisor and the canine. However, it is now understood that this may actually represent an odontogenic cyst, like a lateral periodontal cyst or a fissural cyst. Globulomaxillary cyst in the radiograph may appear as inverted pear-shaped radiolucency between the roots of lateral incisors and canine. The median palatine cyst is a rare non-odontogenic cyst located in the midline of the hard palate, posterior to maxillary central incisors, unlike the nasopalatine cyst, which is more anterior to it. Typically, this cyst appears as a well-defined round or oval radiolucency. The borders are usually smooth and well corticated. The cyst often remains asymptomatic but can cause swelling or the bulging in the midline of the palate as it enlarges. Pseudocysts of the jaws are non-epithelial, fluid-filled lesions that resemble true cysts radiographically, but they lack a true epithelial lining, which is why they are termed as pseudocysts. Although they are not true cysts, they can sometimes be located near the apex of the teeth, resembling periapical lesions on an X-ray. The common pseudocysts relevant to periapical pathology are, first of all, the aneurysmal bone cyst. It is a blood-filled lesion that expands within the jawbone using a blowout or balloon-like radiographic appearance that can present near the apex of the tooth, causing the root displacement. Radiographically, aneurysmal bone cyst typically shows a multilocular radiolucent lesion with a characteristic soap bubble or honeycomb appearance. There is cortical bone expansion or the thinning are also common, which can resemble other aggressive lesion on the imaging. Usually they are well defined but may appear irregular in some cases. Second cyst we'll talk about is simple bone cyst, which is also known as solitary bone cyst, hemorrhagic bone cyst, or the traumatic bone cyst. It is a cavity within the jawbone that may appear as a radiolucent lesion. It has no epithelial lining as it is a pseudocyst, and it is often empty or filled with a fluid. It is commonly found in the mandible. Simple bone cyst appears as a radiolucent, well-defined unilocular radiolucency. The lesion scallops between the roots of the adjacent teeth, and teeth adjacent to the cyst are usually vital and they are not affected. There is no root resorption. Third pseudocyst we'll talk about is Staphney cyst, which is also known as static bone cavity or Staphney bone defect. It is a non-progressive, asymptomatic and benign developmental bone defect usually found in the posterior region of the mandible. On radiograph, it appears as well circumscribed, round or oval radiolucency, and position is typically below the inferior alveolar canal and close to the lower border of the mandible. And it is unique because it does not expand or change over the time, and it is usually unilateral, though bilateral cases can also occur. If we compare Staphney bone defect and simple bone cyst, Staphney bone defect is usually present below the mandibular canal near the angle of the mandible, while the simple bone cyst typically is present in mandible, often in posterior region, and can appear around the roots of the teeth as well. Radiographic appearance of static bone cyst is it is well defined oval or round radiolucency, usually unilateral, but does not cause a bone expansion or root displacement. On the other hand, a simple bone cyst is radiolucent lesion with scalloped border and which may extend between the roots without resorption or expansion. Benign tumor refers to the non-cancerous growth that arise in or around the apical region of the tooth. These tumors are typically slow growing and well defined with minimal potential for metastasis. Ameloblastoma is the second most common odontogenic tumor following odontomas. It arises from the odontogenic epithelium. The most common location for this tumor is the back part of the lower jaw. Cystic ameloblastoma appears as a single cystic lesion, unilocular with well-defined borders on the radiograph, while the multicystic appears as multilocular, often described as a soap bubble or honeycomb appearance. A unicystic is typically smaller and confined to the single lesion, having the well-defined and smooth borders, while the multicystic is larger in size, occupying more extensive area. It is well defined but can be more irregular or ill-defined edges in the aggressive form. Osseous lesions refers to the condition when there is abnormal growth of fibrous tissue and bone within or around the periapical region. The main fibrous lesion encountered in periapical pathology include the Cemento-Osseous dysplasia. Osseous dysplasia actually comes in three variations. The first is the periapical Cemento-Osseous dysplasia. This type is often found around the roots of the teeth. Other is the focal Cemento-Osseous dysplasia. Here we can see it localized in the specific area of a jaw. And the florid Cemento-Osseous dysplasia, this one can affect multiple parts of a jaw, making it more extensive. Periapical cemental dysplasia is commonly known as cementoma, and it affects the periapical area of the anterior mandible. In the early stages, it appears as a well-defined unilocular radiolucency around the root apex, along with the loss of the lamina dura. Here it can be confused with the other endodontic lesions like dental granuloma or radicular cyst. In the second stage, which is known as mixed stage, this stage shows radiolucent areas mixed with radiopaque component. And in the final stages, the lesion may appear totally radiopaque, often with a radiolucent border surrounding it. Fibroma is a type of fibroosseous lesion only, though it is less frequent, but it can affect the periapical region. Fibroma arises from the periodontal ligament and is usually not associated with inflammation. In radiograph, initially it is radiolucent, but may show the mixed radiolucent and the radiopaque areas as it matures. Cementoblastoma is a rare benign tumor that forms at the apex of the tooth, and it is composed primarily of cementum-like material. In radiograph, it may appear as a well-defined radiopacity, usually attached to the root of the affected tooth. Benign periapical lesions are more common than malignant periapical lesions. The most prevalent malignant periapical lesion is oral squamous cell carcinoma. This cancer can manifest as a periapical lesion, particularly when the tumor invades the surrounding tissue. Patient may experience symptoms like persistent pain, swelling, and in some advanced cases, tooth mobility can also be found. Chondrosarcoma, a malignant tumor characterized by the formation of cartilage. This type of tumor occurs in less than 1% of head and neck tumors, but it is important to recognize. Another malignant bone tumor is osteosarcoma that can arise in the jaws. It is known for being aggressive and it is typically associated with severe pain. Patients may experience tooth mobility and noticeable swelling, which can be alarming and warrants immediate attention. Lesions in the jaws are very rare, and the common source is breast followed by the lung. Radiographically, these lesions have poorly defined or irregular borders, which can resemble chronic periapical lesions like cysts or granulomas. These lesions may present as the radiolucent lesions similar to the periapical cyst or granuloma. In some cases, they may also show mixed radiolucency and radiopacity resembling an ossifying fibroma. Significant destruction of bone around the affected area may also be seen. Studies have found that infection like actinomycosis, histoplasmosis, and aspergillosis have been observed in the periapical area. Actinomycosis is one of the most common periapical infection. So all about the periapical pathology of non-inflammatory region. Though all the lesions I have not covered, but I have tried my level best to cover the most relevant and the important lesions. Please go through the summary charts I have provided, and this will provide you a bird eye view of whatever we have learned till now. If you found this video helpful, don't forget to like, share or subscribe for more videos. Stay tuned and thanks for watching. Have a nice day.